Ureteral cancer. Cancer of the ureter, ureteral cancer, is an abnormal growth of cells within the lining of the tubes that connect your kidneys with your bladder. Ureters are part of the urinary tract and carry the urine produced by the kidneys to the bladder. Cervical cancer is rare. It is more common in the elderly and in people who have had bladder cancer. Cervical cancer is closely related to bladder cancer. Cells along the ureters are the same type of cells that line the inside of another. People who are diagnosed with ureteral cancer have a much higher risk of bladder cancer, so your doctor will recommend tests to look for signs of bladder cancer. Treatment for ureteral cancer usually involves surgery. In some cases, chemotherapy or immunotherapy may be recommended. Symptoms, signs and symptoms of ureteral cancer include blood in the urine, back pain when urinating, losing weight without trying, fatigue when to see a doctor. Make an appointment with your doctor if you have persistent signs and symptoms that are bothering you. Causes. It is not clear what causes ureteral cancer. Cervical cancer occurs when cells inside the ureter lining undergo changes, mutations, in their DNA. The cell's DNA contains instructions that tell the cell what to do. Mutations tell cells to multiply rapidly and to continue living beyond their life cycle. The result is a growing amount of abnormal cells that can grow to block the ureter or spread to other parts of the body. Risk factors. Factors that can increase the risk of ureteral cancer include growth of years. The risk of ureteral cancer increases with age. Most people diagnosed with cancer are in their 70s and 80s. Past bladder or kidney cancer. People diagnosed with bladder cancer or kidney cancer have a higher risk of ureteral cancer. Smoking. Smoking increases the risk of ureteral cancer, as well as other cancers of the urinary tract, including kidney cancer and bladder cancer. Family history of cancer. Lynch syndrome, also called hereditary non-polyposis colorectal cancer, HNPCC, increases the risk of colon cancer and other cancers, including ureteral cancer. If you have a strong history of cancer, talk to your doctor. Together you can decide if you will undergo genetic testing for Lynch syndrome and other cancer syndromes. Ureteral cancer diagnosis. Tests and procedures used to detect ureteral cancer include physical examination. Your doctor will ask you questions about your symptoms and signs and do a physical exam to better understand your condition. Testing. Test. Screening may be used to help your doctor determine the severity of your ureteral cancer. Experimental tests may include intravenous pyelogram or CT urography. In some cases, a magnetic resonance urogram may be used if you cannot obtain CT imaging. Urine test. You can have a urine test to check your urine for any abnormalities. Cytology tests can be used to look for abnormal cells in a urine sample. Use of a small, illuminated tube to view the ureters. During a procedure called Ureteroscopy, your doctor will insert a small camera tube inserted into the urethra into your urethra. The scope is transferred to your bladder and ureters. Ureteroscopy allows your doctor to examine your ureters more clearly and, if necessary, remove a small sample of tissue from a laboratory, biopsy. In a lab, a pathologist will carefully examine your cells for signs of cancer. This may include a basic analysis of the genetic variation in your cancer. Bladder cancer screening. Your doctor may examine your bladder using imaging tests or a scan inside your bladder, cystoscopy, to look for signs of bladder cancer. People diagnosed with ureteral cancer are at greater risk for bladder cancer. It could be at the same time as your ureteral cancer or develop immediately after treatment. Treatment for cervical cancer usually involves surgery. Your ureter cancer treatment options will vary depending on the size and location of your cancer, how aggressive the cells are, and your goals and preferences. Surgery is often recommended to remove ureteral cancer. The extent of your surgery will depend on your condition. With very early stage ureteral cancer, surgery may involve removing only part of the ureter. With advanced ureteral cancer, you may need to remove the affected ureter, associated kidney, nephroureterectomy, and part of the bladder. Chemotherapy is a treatment that uses chemicals to kill cancer cells. Chemotherapy is sometimes used before surgery to reduce the tumor and make it easier to remove during surgery. Chemotherapy can be used after surgery to kill any cancer cells that may remain. For advanced ureteral cancer, Chemotherapy can be used to control the signs and symptoms of cancer. Immunotherapy uses your immune system to fight cancer. Your immune system may not attack your cancer because the cancer cells produce proteins that help them to hide in the body's cells. Immunotherapy works by disrupting that process. Immunotherapy can be a treatment for advanced ureteral cancer that has not responded to other treatments. Follow-up test. After your treatment, your doctor will perform a follow-up test to look for signs that your cancer has returned. These tests also look for symptoms of bladder cancer, since people diagnosed with ureteral cancer are at greater risk of developing bladder cancer. The tests you will face and the exercise program will depend on your situation. But expect to see your doctor every few months of the first year and often thereafter. Preparing for your appointment. If you have signs or symptoms that are bothering you, make an appointment with your doctor. If you are diagnosed with ureteral cancer, you may be referred to a urologist, or oncologist. Because appointments can be short and because there are many details to discuss, it is a good idea to prepare. What you can do: be aware of the symptoms you are experiencing. If you have ever had symptoms or signs of illness or just feel unwell, write down the details before your appointment. Your doctor will also want to know when to begin recognizing these symptoms and how they have changed over time. Make a list of your medications. Take any prescription or over-the-counter medication you are taking, with all the vitamins, supplements, and herbs you need. Take a family member or friend. Sometimes it can be difficult to remember all the details provided during the appointment. Your traveling companion may remember something that you missed. Write down the questions you will ask your doctor. Questions you should ask your doctor at your first appointment include: what can cause my symptoms or condition? Are there other possible causes? What types of tests do I need? What do you recommend about the next steps in deciding my diagnosis and treatment? Are there any restrictions I need to follow right now? Questions to consider when your doctor refers you to a specialist include: do I have ureteral cancer? What are the medical goals for me? What treatment do you recommend? Is it necessary to start treatment immediately? I have other health problems. How can I treat them better together? What are the side effects of the treatment? If the first treatment fails, what will we try next? What is my opinion of my situation? In addition to the questions you have prepared to ask your doctor, do not hesitate to ask questions during your appointment at any time if you do not understand something. What to expect from your doctor: your doctor may ask you many questions. Thinking ahead of time can help you to make the most of your time. Your doctor may ask: what are your symptoms, if any? When did you first experience symptoms? How have your symptoms changed over time? Have you been diagnosed or treated with any other medical conditions? What medications do you take?